Hello and welcome to this podcast, Expert Voices in Clinical Aromatherapy. For this first episode, we are with Wendy Maddocks, nursing educator and postgraduate supervisor in New Zealand, who will talk about the importance of clinical research in aromatherapy. Wendy presents her findings in her latest scoping review of articles published during the last 15 years describing nursing and midwife practices. She describes the important criteria to conduct clinical research and illustrates it with the publication of Linda Ann O'Flaherty, winner of the 2021 International René-Maurice Gattefossé Prize. Enjoy listening!
So in January 2022, I published an extensive scoping review of articles related to clinical aromatherapy in nursing and midwifery practice, published in the English language since 2004. 124 articles were included in the review, and I included experimental and quasi-experimental studies to ensure I had a broad scope within the review. I did not review case studies or any animal studies or studies that were not involved in a clinical environment where patients, nurses or midwives were. So that meant that I did not have people operating from their home, for example, involved in the review. On a positive note, the scoping review identified that there was statistically significant evidence to support the use of clinical aromatherapy in things like post-operative nausea and vomiting, chronic pain conditions, and conditions of anxiety, stress, sleep disorder, both in adults, children, and patients undergoing treatment such as cancer treatments. There was also some evidence around maternal health and well-being and for the newborn child. And I think one of the key things to take from this review is that over 19,000 patients were included in the review, and there was less than 5 adverse effects experienced by people. And these were very minor effects, things like headaches, or they actually didn't like the smell that they were using at the time. With regards to the quality of the studies, to be included in my review, I was following a PRISMA scoping review protocol, so there was many studies that weren't included. Even though validated tools were used in most of the studies that I reviewed, so things like state trait anxiety, pain scores, Pittsburgh Sleep Index, there was key information missing in some of the studies, which clouded the quality and makes it difficult to accurately replicate those studies. And a really simple mistake was not identifying precisely the essential oils. What was the botanical species? What was the chemical analysis of the oils? And this is very simple information for researchers to include. I think the scoping review as a whole makes a significant contribution to the practice of clinical aromatherapy, providing further support for healthcare workers within a clinical environment to use aromatherapy for certain conditions. We've still got a long way to go. So I think when we're looking further, the next stage of research of clinical aromatherapy, we need to be able to take in more of the whole person. It's not just a single intervention for a single problem. The patient as a whole has other conditions, worries or concerns, and when we're doing aromatherapy research or using essential oils in a clinical setting, we need to think about those other factors. We also need to remember that conducting research in a clinical environment is expensive. It's time consuming for the clinicians or the people that are coming in. Patient conditions are very variable, and researchers in these spaces need to work and operate within the clinical constraints that are going on around a patient care environment. And I would like to see for future researchers more primary healthcare outpatient types of studies that are still clinical aromatherapy but not necessarily done right within a fast-paced hospital environment. It's about the care outside of the home that people are obtaining. So I'd like to now describe an example of some really sound clinical aromatherapy research that was conducted by Linda Ann Flaherty in South Africa that was published recently. And Linda's study is a fantastic example of both the benefits of aromatherapy conducted on children in an intensive care unit at a time of crisis in their life. Linda was putting in careful measures to make sure that the data she was collecting was able to be validated, was able to be replicated. She was filming responses and having someone look at the recorded responses of the intervention so that she was adding in controls and blinding to the study. And at the end of that process, she was gathering and putting that data together that gives a really comprehensive perspective of clinical aromatherapy, capturing both the scientific empirical data that we need, but also the more whole person, family, child interactions. And I think that is what clinical aromatherapy is about. It's not just one intervention for one problem, and having and supporting research like that in an environment where she had access to a significant number of patients that met a very narrow research criteria and able to show that there was benefit to her patients. And I think that is what's important about research in this space. What makes Linda Ann's research and the way it's written up and presented for other therapists and other health professionals to read is the way, the methodology that she's used, the descriptions exactly of the treatments, of the oils, the steps and the processes that she's gone through. So another researcher in another country who has access to that same patient demographic could take her study and reproduce and revalidate those findings in a different country, in a different hospital, where there may be some other cultural factors to consider, but the framework is there. And I think that is what's missing from some of the studies, sadly, that we are seeing in the literature, that there isn't that basic framework of good research methodology, description of the interventions, as well as the analysis of the data. So for future aromatherapy research, I think there's two key aspects that we need to consider within the clinical aromatherapy profession, and they are urgent, like happening right now. Firstly, we need to make clinical aromatherapy practitioners more effective research consumers. They need to be able to read the scientific studies, the clinical studies that are being published in vast numbers, and as I mentioned earlier, really quite variable quality. So they need to be able to make an appraisal of that. And this is where the initiative by the Association of ARCOT are coming in with an evaluative tool called TREATS. And I think that will make the process for busy clinical aromatherapy practitioners and other researchers easier to make those evaluations, make those judgments of the research that's being published, and work out, is this a good evidence-based article that contains knowledge that I can use in my clinical practice. The second part of that is really upskilling researchers in clinical aromatherapy, and they may need to partner with other people who are expert in the research methodology, more collaborative publications between the clinicians and academic institutions or academics who have the methodology and are able to put together really sound evidence-based articles that have value to the profession. And if we can't do that, then there is no point. We can't grow clinical aromatherapy, we can't advance, and we can't be effective practitioners moving forwards.
This was a podcast produced by the Gattefossé Foundation for Clinical Aromatherapy. In the next episode, Denis Josviak will share our knowledge and experience of aromatherapy practices in the United States of America. To learn more and discover the projects of the Gattefossé Foundation, please visit our website. Thank you for listening and come back soon!